and good day. My name is Jürgen Steinmetz from eTurboNews, and this is a breaking news update. For more news updates and shows, please go to youtube.com/travel news group. youtube.com/travel news group. Here's our update.
Italy Minister of Health new update on Omicron crisis. An interview of the Italy Minister of Health, Roberto Speranza, on the television show Chi Tempo Chi Fa on RAI3 tonight, December 20, 2021, on the topic of the current COVID-19 Omicron crisis, revealed the minister saying, "The situation is worrying. We will evaluate on Thursday." Minister Speranza explained that the spread of COVID-19 variants has made itself known by the numbers being generated: 24,529 new cases and 97 deaths, with 566,300 swabs in the past 24 hours. We must keep our guard up. The scope of this Omicron is a new and relevant fact, and we will have higher numbers, but let's try not to lose the advantage. Today, we will exceed 1 to 5 million doses of the vaccine. The Ministry of Health confirmed positivity at 4.3% circular, with the minister stating Italy is in an acute epidemic phase. The challenge is open. The government is studying the New Year squeeze and considering a buffer hypothesis for all for indoor premises. Just a few days ago on December 19, Minister Speranza had made a plea for maximum precaution, prudence, and avoiding gatherings as much as possible during the Christmas holidays in a TV interview with Fabio Fazio. The interview was also an opportunity to take stock of any new anti-COVID measures. No decision has been taken. There will be a flash survey on December 20 and only on Thursday, December 23. Based on the data, we will make our assessment, Speranza reported. There is an element of concern on the part of the government. The minister added, "We are discussing and we will evaluate possible solutions." Today, Italy is the EU country that has the most extensive vaccination obligation for various categories, after which we will verify the epidemiological data and also the scope of the Omicron variant. The measures we choose will always be weighted with respect to the situation. Surely there is a difficult situation at a European level and also at an Italian level. The numbers are growing, even if they are still far better than other European countries than ours, but it is quite clear that there has been a rather constant significant growth in recent weeks, and that if it continues like this, it can be a risk, putting health structures in difficulty. Vaccines and masks. The minister stated the data from Great Britain, which we always look at carefully because it often anticipated us, tells us that we are facing a new challenge. However, we are in a different phase compared to last year when we were in the red zone in all the days, very hard closures, the number of deaths larger than today. We don't have those numbers now, and we haven't done any closures, and it is because we have carried out a great vaccination campaign. We must insist on the two levers: booster doses and use of masks. Parties require maximum precaution and utmost prudence, avoiding gatherings and places where one can be infected as much as possible. Children. Continuing, Minister Speranza said in the first 2 days, we reached the quota of over 52,000 children between 5 and 11 years. This figure also includes my 2 children, Michelle and Emma. Let's trust our scientists, let's trust our doctors, let's trust our pediatricians. The government has taken a cautious stance on the obligation to vaccinate students because there is an essential right, which is that of health, but also a right to education. I have read the mayor's request, which deserves to be studied in depth, but the effort of the government is to find conditions to protect the schools as much as possible. Third dose. In conclusion, Minister Speranza stated the first data we received tells us that the third dose allows us to regain a very significant level of protection. I invite all those who are entitled to do so as soon as possible because it is the best shield that can prepare us for when in a few weeks the Omicron variant will be much more present in our country. Doing the third dose and using the mask, these weapons we have, are a significant shield to the Omicron variant. The EMA has authorized the third dose only for ages 18 and up, and we are waiting for EMA''s European Medicines Agency indications. I will favor a comparison with AIFA Agenzia Italiana del Farmaco and EMA over the third dose for under 18s. We will evaluate the congruity of the measures by reflecting with our scientists. We have made some choices. The state of emergency has been extended and the level of attention raised with respect to arrivals from abroad and from other European countries. More news about Italy. Number Omicron. Number COVID.
you for listening to our news update. There's more on youtube.com/travel news group, or you can read us, of course, in going to our news portal at eTurboNews.com or travelnews.online.